Good afternoon. My name is John Frank. It's my pleasure to be part of this session today. We're going to be discussing the African Pathogen Genomics Initiative, and we're going to be here to learn from Sophonius Tesema, who's the program leader for the Africa PGI project. And so let me begin by saying welcome, and can you please tell us, what is Africa PGI?
Thanks, John, and good afternoon, everyone. So the Africa Pathogen Genomics Initiative is a multi-sectoral initiative of the Africa CDC. It was launched in 2020 in collaboration with partners from the private sectors such as Illumina, Oxford Nanopore Technologies, Microsoft, from the philanthropic sectors, Bill and Melinda Gates Foundation, and other philanthropists as well, and then also public sector such as the US CDC, and in collaboration with national public health institutes across the African continent. So the goal of the initiative is to empower national public health institutes across the continent to be able to have advanced disease surveillance system and capabilities to be able to improve outbreak detection, outbreak surveillance, outbreak response, as well as informing the control and elimination of infectious diseases across the continent. So that is the bigger goal of the initiative.
Well, given there was things happening in the world when you launched in 2020, you're probably best known for doing COVID surveillance, but you do much more than that. So tell us more about the scope of the pathogens that you're interested in.
So the launch of the Africa Pathogen Genomics Initiative is built on a work that we've been doing, or Africa CDC has been doing, prior to the COVID-19 pandemic. So the whole initiative, the idea started in 2018, which is 1 year after the establishment of the Africa Center for Disease Control and Prevention. So the Africa CDC, when it was launched in 2017, the goal is to improve the disease surveillance landscape, the outbreak detection, the outbreak response across the continent of Africa, which was built on the challenge that we faced as an African continent in 2014, 2015, when we have the Ebola outbreak in West Africa. So it was a work in progress since 2014, 2015. And then in 2017, the Africa CDC was launched by the African heads of states by the African Union. So a lot of the work was not about COVID. It was about how do we improve disease surveillance in the continent? How do we empower national public health institutes with the technologies that are currently available to conduct surveillance, to improve disease detection and outbreak response? And how do we bring precision public health into the African continent? So it's much more broader than the COVID-19 since its inception. But the COVID-19 pandemic helped to accelerate that process, accelerate the implementation of the project. And now we are moving beyond the COVID-19 and bringing other use cases, because in Africa we have several challenges of emerging and re-emerging diseases. If we go back into 1950s and see the emergence of infectious diseases, whether it's Ebola, Marburg, cholera, or polio, so we have so much beyond COVID-19 that this technology can be applied for to improve disease surveillance and to improve our response and efficiency in combating infectious diseases in Africa. So the idea is, how do we utilize new technologies, emerging technologies, in response to emerging and re-emerging diseases, as well as in response to endemic diseases such as HIV, malaria, TB, where this technology can actually give us much more better information to inform our control and elimination programs.
Excellent. And I should mention to the audience that I'm the Chief Public Affairs Officer at Illumina, which is a partner. And we provide much, we're not the exclusive provider, but we provide a lot of the genomic sequencing equipment. And it's been fascinating because I think people had doubts that genomic sequencing could be distributed throughout national labs across Africa, but you've done that. How many countries now in the national labs have genomic sequencing?
Yeah, so John, I think that is really an important point. When we started this project in 2018, 2019, we conducted a continental assessment to know that which countries have this capability, which countries do not have the capability, which countries can actually start implementing this technology based on the needed workforce, the needed infrastructure, laboratory and personnel infrastructure that's needed to do this. In 2019, just before the pandemic, there were only 7 countries in Africa that had the capability to be able to do sequencing. Today, as we speak, we have more than 36 countries that have these capabilities. So I think the way how PGI was organized by bringing the private sector, the public sector, the philanthropic sector, and working closely with the National Public Health Institute, it really helped to accelerate the implementation of this technology. Today, every country wants it, and every country knows that they need it for disease surveillance. So the technology is now much, much more closer to national public health institutions that didn't have access to it 2 years ago. So yeah, it's widely available now.
So I've got to, it's taken a lot of different people to make this successful, but to have 36 countries working on with international labs and the Africa CDC as part of the Africa Union providing the leadership and really making this project successful. But when was the moment when you realized, you told me there was lots of moments you weren't sure this was going to work. When did you think it was, when did the lights say this is going?
I think I remember the exact time that we thought this will work. We gathered the whole of the continent across the different countries to discuss about the challenge, the opportunities, and how best we can implement this in the continent. It was in January. The meeting was on 17th of January, just at the beginning of the COVID-19 in 2020. And while we're discussing the challenge, we're hearing quite a lot of need and demand from the countries. Everyone was saying that this is a technology that we need in the continent to be able to improve our surveillance system. I think at the end of that meeting, we were very hopeful that there is a strong acceptance from the countries and demand from the countries. And the questions were more about access to the technology. The questions were more about how do we expand it, how do we scale it. And we were given quite a lot of assignment by the participants saying that Africa CDC need to do this, this, and this, and that. So which we took as an opportunity to leverage on in expanding the capacity across the continent. I think that was the moment that we were very hopeful.
So let's just take a moment to talk about what are the kinds of, when it comes to a disease, what are the benefits that a country gets by doing genomic sequencing for the monitoring?
So I think the benefits are very wide. And I would also like to emphasize that the nature of surveillance that we need in Africa, it has to be much more broader because we have different types of diseases, and we have a changing landscape, increasing in population, increased climate change, deforestation. All of that actually demands to have a better surveillance system so that we know what kind of pathogens are circulating in the continent. So the type of information that we can get, it's not only about knowing what pathogen it is. It's knowing about what exactly that pathogen is. I think the power of genomics is we can get as much information as we can about a pathogen, what it is, what variant it is, what kind of pathogen is circulating, how it's changing over time, and all of that kind of information that's really needed for disease surveillance in the continent. So when we think about application of genomics for disease surveillance, we would like to think more broadly in applying it for outbreak detection, not only in the the human population, but also in the animal-human interface, as well as in the environment, because we need to have a more integrated disease surveillance system to better control it and to better respond to it.
You know, I think the detection that you did, or the network accomplished, that was probably most known to people here would be when South Africa identified the Omicron variant. And of course, the world reacted by saying, well, we're shutting off South Africa. And it wasn't that South Africa was where it started. Just because of the surveillance work being done, they were the first to identify it. What's the lesson from that?
I think that decision that was made by some countries to ban South Africa and in general Southern Africa was wrong, and we need to learn from that because detecting a variant and sharing that information in real time is something that we all want for the world. Every country should be able to have that responsibility and do that in a timely manner. That's exactly what South Africa did. That's exactly what Botswana did, and that's what we've been pushing for countries to do. Share your data as quickly as possible. Generate the data and don't store it. Share it so that the world knows what is circulating, what is happening everywhere. But the response to that is something that we need to learn from. I think although the response was negative, the response was ban, the response was not what we all want, but the countries, South Africa, continued to share data even after the ban. While they were in travel ban, they were sharing data. I think that's what we want. That's what every country needs to learn from South Africa, Botswana, and all those African countries that are trying to share data. I think in the future, we shouldn't just only talk about benefit sharing. We also need to talk about sharing of the risks, the risk of data sharing. Because they shared the data, they were banned. But they were telling the world that this variant is an important variant that can actually affect all of us. And it showed that we all are affected by Omicron. Yep. So I think we also need to think about sharing of the risks.
It's a great teaching moment that we should be learning from as we go forward with this.
Exactly.
Can I just ask about, part of the goal that you have is to build capacity for applying genomic science to public health across the continent with the national labs. What are the kinds of training and capacity building projects that you have?
So I think the type of training that we are trying to implement is in 4 categories. The first one is technical level training for laboratory technicians. Another type of training is for bioinformaticians and data scientists, where we try to train data analysis, interpretation, and utilization of the data. And the third type of training is for epidemiologists, because in Africa we have epidemiologists that have been doing a lot of the surveillance work. So how do we bring genomics into that surveillance? So to integrate genomics into the disease surveillance work, we need more training to the epidemiologists so that they are aware of the power of genomics for surveillance. And the last category of training is more high level, for directors of institutions, for Ministry of Health officials, where we try to make sure that they're aware of genomic technologies and the power of genomics in improving and leapfrogging our surveillance system. So these are the different types of trainings that we are trying to do in Africa.
Right. And the price of genomic sequencing continues to go down and down and down. And with recent announcements at Illumina, the cold storage of the chemicals is no longer going to be required, which will be greatly helpful to be able to send chemicals and things to remote places. But it is, I think for us, we're watching the experiment, and it's really terrific to see successful deployment of this very sophisticated technology so broadly within the national labs. Yeah,
so of course the cost of sequencing is going down. which makes it more accessible. But most importantly, it's not only the cost that is hindering access to national public health institutes in Africa, it's the cold chain requirements, the custom clearance, the regulatory requirements that we have in some countries. All of that adds up in delaying the deployment of this technology into the continent. I think it's very exciting to see that the investment of the private sector is not only going to the cost of the machine, but also thinking about changing the supply chain system, reducing the cold chain requirement. That's really an exciting time to be in increasing access to genomics for countries where there is no infrastructure for cold chain shipment. There are so many airports in Africa where there is no cold chain storage. So if we want to ship this kind of specimens without the cold chain storage, it's very difficult. So looking into this new era of genomics where the cold chain requirement is being reduced, together with the cost of the sequencing being reduced, I think it really is important to expand access to genomics into countries that do not have access to it before.
Well, I've got lots more questions, but we don't have any time.
Yeah.
But I just want to congratulate the Africa CDC and the national labs for this initiative. It's really been terrific, and it provides a foundation for bringing more advanced science for healthcare and a broad range of applications in these countries. And so just really tremendous gratitude, appreciation for the great work of the African CDC and your team, and the collaboration of the broader multi-stakeholder group. So please join me in thanking Sophonius.
Thanks.